This is a right shoulder in a patient who has had a history of multiple dislocations where the humeral head has slid out towards the front of the glenoid. In this video, the patient's lying on their side, the camera is coming in from the back of the shoulder, and the probe is towards the front of the shoulder. The humeral head is on the top of the screen, and the glenoid or socket is on the bottom. The probe is showing the interface between the glenoid and the labrum, which should be attached to the front of the glenoid. Towards the bottom of the socket or glenoid, the labrum is well attached, but in the front, the labrum is detached, causing the patient to have episodes of instability. A high-speed burr is brought in to decorticate and smooth and roughen up the bone on the front edge of the glenoid. This ensures that when we repair the labrum and ligaments back to the glenoid, that they will heal in a secure fashion. Once we have prepared the glenoid, curved tissue passing devices are used to pass through the ligaments, capsule, and labrum. Once the sharp tissue passing devices are passed through the ligaments and the labrum, a dissolvable monofilament suture is passed and then exchanged for a high-strength braided suture that can withstand the forces that a normal shoulder subjects to the ligaments. When the labrum is torn off the bone, anchors must be placed into the glenoid to secure the capsule and ligaments to the edge of the glenoid. A bone tap is used to prepare a tunnel to allow the anchor to be inserted into the bone. The anchor has sutures originating from the anchor, which we then pass through the capsule and ligaments. Once the anchor is in place, we can then use tissue passing devices again to pierce through the tissue. Now that the anchor is in place, we pierce through the ligaments and capsule, pass our monofilament suture, which allows us to shuttle the braided suture that's already attached to the anchor. The braided suture passes through the capsule and ligaments. And now we can tie an arthroscopic knot which will secure the capsule and ligament to the side of the glenoid, thereby repairing the capsule and ligaments to the glenoid and thereby securing the ligaments and tightening up the shoulder joint with the hopeful eventual outcome of avoiding future dislocations.